The colonoscopy is where we take a camera that's on a device that's real flexible and it maneuvers through our intestines very easily to see all parts of our large intestines or colon to look for polyps or any abnormality of the lining of the colon. The procedure is about 15 minutes or so on average, but it can go a little longer depending on what's found. And with that device, we can use small instruments that can fit through it to maneuver or biopsy or remove polyps or tumors, or biopsy any abnormality to get a diagnosis. During the procedure, there's another physician in the room called an anesthesiologist that gives medications in the IV or vein that puts patients to sleep. The good news is it wears off really quickly, so people can be comfortable, not aware of what's going on, have their procedure, and then wake up pretty rapidly so they can go about their day once they're completed their procedure. This is very, very, very rare. When we're talking about doing a surgical procedure after a colonoscopy, specifically a colostomy bag, which is bringing the small bowel to the skin so that you can eat and your bowels will move. This is in rare conditions or rare situations where there may be a rupture or a blockage that we can't open up with that camera, and to relieve the person's symptoms if they're occurring. To do a colostomy routinely after a colonoscopy is extremely, extremely rare. I'll tell them for a person who does the colonoscopies, and I've had mine, it's easy. The most important thing is just do the proper prep so that the bowel's completely clean, and the physician who's doing the procedure can assess the entire colon without any issues. And if you do these things, it's a very straightforward exam. It provides a lot of information that you can't get from other tests that are maybe similar, including biopsies. So it's very advantageous, and that's why it remains the standard of care and gold standard for assessing the colon and rectum. We want patients to be as safe as possible. Driving to the procedure, that's usually fine. It's leaving afterwards. The effects of the anesthesia can linger, and we don't want people to be disoriented or loss of coordination when they're driving a vehicle. Most facilities, if not all, have a policy where you have to have another responsible adult take you home after receiving anesthesia, even for a colonoscopy. It's for the safety of the patients.